Thank you very much for taking your precious time out of your very busy schedules to join us today for this joint press conference. We would like to start our press conference today on business partnerships in the healthcare and medical fields aimed at realizing sustainable healthcare. So let us first introduce from Sumitomo Mitsui Financial Group, Group CEO and President, Toru Nakashima will be making the first presentation.
Thank you very much for the introduction. I am Nakashima. Thank you very much for taking a time out of your busy schedule to join us today. I'd like to talk about creating sustainable healthcare and prosperity for future generations. We are pleased to announce that the SoftBank, Fujitsu, and the SMBC Group have reached a basic agreement to collaborate in the health and medical fields. This partnership is based on our firm determination as a private companies to unite and contribute to the realization of sustainable healthcare through our business activities. We have an extremely heavy responsibility to protect the world-class universal health insurance system that our predecessors built, and to leave the prosperous and secure Japanese society for the future generations. But now, we stand at the historical watershed. This is the 2040 problem when the baby boomers generation's children enter old age. With the elderly population reaching its peak, national healthcare expenditures are projected to increase from the current 50 trillion yen to 70 to 80 trillion yen by 2040. Furthermore, as the working age population continues to decline, if left unchecked, it will inevitably lead to a destructive vicious cycle where disposable income of the working generation is reduced, further accelerating the decline in birth rate. The greatest key to overcome this national crisis lies in the health and well-being of all generations, including seniors. In particular, the wealth of experience and wisdom that the senior citizens have cultivated is an invaluable asset to our country. If people of all generations can maintain their health and remain active in society for a long time, the situation will improve dramatically. By curbing the increase of healthcare costs, the national budget will gain more leeway, and overall labor shortage in the society will also be alleviated. As a result, the burden of the working generation decreases and their take-home pay increases. This is precisely what will bring hope to the future to young people and become the driving force that will powerfully propel our country's new economic growth. The health and well-being of all generations, including seniors, will create prosperity for the future generation. We aspire to build a future Japan where all the generations can thrive together. To achieve this, instead of leaving everything to the government, we as a private company leading the current generation will utilize the cutting-edge digital technologies such as data, AI, and smartphones to develop Japan-made healthcare infrastructure for sustainable medical care. We will provide society with value such as improving convenience for patients, extending the healthy life expectancy of people, and improving efficiency in medical institutions and reducing the burden on healthcare professionals. This goal can only be achieved by combining the strength of each company. SoftBank, with its overwhelming customer base and the expertise cultivated through its healthcare app, Helpo, will be in charge of the user app on the left-hand side of this diagram. Fujitsu will leverage its overwhelming market share and expertise in the electronic medical record business for large hospitals to take on the role of data platform on the right-hand side of this slide, establishing collaboration with the medical institutions and building strict data governance. Our role is to leverage the SMBC Group's customer base to deliver more advanced next-generation healthcare services to a wider range of customers. In March this year, based on our partnership with SoftBank, we have already launched Olive Healthcare. And this partnership will significantly enhance this Olive Healthcare service. At the same time, we are also working to integrate and collaborate with financial services, aiming to provide a sense of security in terms of both money and health. Furthermore, PlusMedi, which is a startup that joined SMBC Group in 2020, offer a hospital visit support app based on the banking service information provided by SMBC to patients. By returning the medical data to patients with their consent and using it to reduce the stress of hospital visits and improve the efficiency of the hospital operations, we have received high evaluation from both patients and hospitals. We believe that the relationship that the PlusMedi has cultivated with medical institutions, centered on the interests of patients, and cooperative relationship with the multiple EMR manufacturers such as Fujitsu, NEC, and IBM Japan, we believe that this will be a major asset. We aim to elevate this partnership beyond just one-off business into a national initiative and national service. To achieve this, we intend to seek participation from a diverse range of partners across various industries and to work closely with national as well as local governments. To leave the better Japan for the future generations, we will combine the strength of our three companies and strive to realize sustainable society. Thank you very much for your attention. Now I hand it over to Mr. Tokita, the president of Fujitsu.
And now we will hear a presentation from Mr. Takahito Tokita, CEO and Representative Director of Fujitsu Limited. Good morning, everybody. My name is Tokita from Fujitsu. Thank you very much for your precious time to join us this morning amidst your busy schedules. And as Mr. Nakashima just mentioned in the beginning, by combining the strength of each company and through business, we would like to contribute to the realization of sustainable healthcare by cooperation of our three entities. And as you all know, the Sumitomo Mitsui Financial Group, SoftBank, are experts in the areas of finance and telecommunications and personal services, and we are supporting Japan through our business expertise. And with these two partners, I am extremely honored that we are empowered to be able to advance this initiative together with these players. And so let me talk about our company's role from my own perspective. As Mr. Nakashima explained, thanks to the efforts of our predecessors, Japanese healthcare system is of very high quality and is open to the public and has been supporting the daily lives of people. And in order to continue to maintain this fabulous system in a stable manner, we have to overcome various issues. And our company has, for 50 years, been involved in the medical field for many years, and we have worked with various medical institutions and have been supporting the development of Japanese medical industry. And I have visited many hospitals throughout the company and have spoken with many of the people in the medical profession. And many people talk about the delay in the digital transformation and about the negative impact on national competitiveness that have been raised. And Also we have the challenges of budget restraints on IT, and there are many issues that need to be overcome, and we have heard so many opinions from those people in the medical profession. And we need to really take this seriously and move on to resolve these issues. And our company will do the following with these three strength areas. The first is this energy efficient and high performance CPU called Fujitsu Monaka, and the business specific LLM called Takane. These are leading the way in future innovation, and we are honored to have these kinds of technologies at leading world cutting edge technology. The second is the medical record data system HOPE and the Healthy Living platform, and we will be basing this knowledge on our medical field that we have nurtured through our cooperation with the medical institutions over time and the knowledge. The third is our company's UVANS, which is a central system which we serve customers across various industries. And together with our partners through business, we have been working to solve social issues, and this is a cross-industry track record, and its know-how is what we boast. And we would like to make use of these, leverage on these three major strengths so that we will be working together with the Sumitomo Mitsui Financial Group and SoftBank together going forward. And this time we are using personal health data and electronic medical records and medical data held by medical institutions. And by linking these data, we can generate a new information system, which is a domestically produced healthcare infrastructure. And through this platform, individuals, medical institutions, and a diverse range of private companies, including those in the healthcare sector, will be able to work together with the national government and local governments on various subjects, and we will be able to create valuable information, and we will continue to provide such valuable information. And for the individuals, as you can see on the left-hand side of the diagram, under the leadership of SoftBank, we are using AI-implemented systems supporting individual health necessary for health promotion. And as you can see on the right-hand side, we will be looking into medical data with different specifications such as treatment, diagnosis, and prescription. And we will work together with these institutions, enabling safe and secure distribution and building a data platform. And on this platform, we would like to incorporate our knowledge from the medical field, which we developed, and a product specializing in medical information, which is the Takane LLM. We will use this to standardize the data so that it can be widely shared. And in medical institutions and other businesses, we will be promoting the utilization of data and create a new healthcare-related services, and we will develop them and improve them to medical institutions and operations. And this platform is not only for each hospital, but the hospital will be divided into different departments, and the vast amount of medical data, standardization, and individual information will be combined and integrated. And through integration of such health data, we will be able to turn it into valuable data. And the individuals will be able to make full use of their own health and medical data based on one's own will and judgment. And one of the characteristics is that it is an ability to be distributed. And valuable data will be supporting people's health, and it will spread to many stakeholders, and it will be utilized by many people, thereby promoting and improving the service levels for each individual in the healthcare and medical services. And we will be able to further develop a wider variety of health services. Fujitsu, through this alliance, will be able to promote individual data sovereignty, personalized medicine, and industrial innovation centered on healthcare, and we will be able to integrate this, and we will be able to move towards a new form of healthcare that starts from within the individual to bring about a paradigm shift. And therefore, We would like to spread this platform widely throughout the country. And this time, we have been rolling out this system to 4,000 new medical institutions. 4,000 is a very ambitious figure, but we have been working with medical institutions nationwide for many, many years, and we have a trustworthy relationship. And as a company that leverages strong relationships, I believe we will be able to accomplish this scale. And Sumitomo Mitsui Financial Group and SoftBank, we will be working together with these two entities, and we will be providing this new data system to 60 million people, and we will be able to achieve a cross-industry level, providing high-quality medical care, and also promote industrial innovation. This concludes my presentation. Thank you very much. And now we'd like to move on to Mr. Miyakawa from SoftBank. Thank you very much. And now we'd like to move on to a presentation by Representative Director, President, and CEO, Mr. Junichi Miyakawa from SoftBank. Thank you very much. My name is Miyakawa from SoftBank. Thank you very much for joining us this morning. And as Mr. Nakashima mentioned earlier, the medical expenses of our country, if we continue at this pace, in 15 years, the amount will be exceeding 30 trillion yen. That is the calculation. And that means that it is no longer an issue for the medical industry alone, but it is an issue for the survival of our nation itself. And our alliance this time is to work together with SMBC and Fujitsu, and by putting together the insights of these two entities, we would like to integrate the health data and medical data together so that we will be able to realize a sustainable healthcare in the future. And this is the big picture. And as you have been hearing, on the right-hand side, we have the data platform. As Mr. Tokita explained, this will be led by Fujitsu. And on the left-hand side, for the user app, will be led by SoftBank. And the user application uses vital data and body conditions and data. And these are the kind of data that are used in healthcare institutions and also together with the electronic medical records and prescriptions data used in medical institutions. We will be combining these data. And just to show you some examples, for example, if the user makes a number of steps a year, let's say that a person has a data of walking 3,200 steps in a day, and with high blood pressure, this is a data that is held by the medical institution. And by combining these on the app, and we can give a recommendation of walking for at least 15 minutes every day. And this is something that will be easy to understand to improve the health condition of that person. And also, if the average sleeping time of the user is 4 hours and 55 minutes, and if that person has a medical consultation record of not being able to sleep, and by combining these two information to improve the sleep quality, we can provide a recommendation of not looking at one smartphone at least 1 hour before going to bed.
Also, what you eat, and we combine it with your medical history, for example, being diabetes, and we provide warnings regarding the blood sugar levels. It also includes the functions for making appointments and payments. Based on the information such as symptoms and medical history, the app will suggest the suitable hospital options and allow users to make reservations through an app and also make changes to the reservations. Furthermore, it will provide a seamless experience by completing the entire process from the consultation to the payment within the app. This user app is going to be developed by the SoftBank, SMBC, and Fujitsu by leveraging each customer touchpoint and we would like to expand this rapidly. And in the future, we would like to, in addition to the 4,000 medical institutions, we would like to expand these services to about the 60 million users. So today we announced a partnership by 3 companies. We have been working to find a way to improve the current situation of the ever-increasing medical costs. We have done so individually, but we decided that this level of efforts will not lead to the drastic improvement. We have decided, therefore, to unify the initiatives of each company and accelerate this progress. And through the construction of this Japan-made healthcare platform, we aim to provide value to a wide-ranging sectors from individuals, medical institutions, as well as to the national and local governments. We will seriously address the social challenge of healthcare sustainability. With this platform, for example, until now, there were some duplicate testing, duplicate prescriptions, but we can reduce that. And we can integrate and align medical information and prescription information to reduce such waste. And also, we hope to contribute to extending the healthy life expectancy through the prevention and healthcare support. Through those efforts, we aim to reduce the medical expenditures by 5 trillion yen. I think there could be various obstacles and challenges in developing such Japan-made healthcare infrastructure. Nevertheless, I believe now is the time to tackle this issue in order to ensure the sustainability of our country's proud insurance system. If there are any companies or hospitals or local governments that would like to work with us, we would like to welcome you so that we can work together. With that, I would like to end my part of presentation. Thank you very much for your attention. Thank you very much. Next, we'd like to have a photo session. So please bear with us until we complete the preparations. Thank you very much for waiting. We'd like to now take questions.
Now, if you have any questions, please do mention your name and affiliation before you ask your question. We will be taking only 2 questions per person and limited to what was presented in today's presentations. And if you would like to specify the respondent, please mention the respondent's name. And the press conference will be streamlined later on. Please do raise your hand if you have any questions. So the person on third from the front on the left-hand side, please. Thank you very much. My name is Yagi from Nikkei Shimbun, and I have 2 questions to ask. So with the increase in medical costs has been a social issue for a long time, but why is it that you have decided to tackle this issue right now? And with these 3 entities, when did you start talking about this kind of alliance and who took the lead in this? So please elaborate about that. So that is my first question. So on the first question, can somebody please respond? So, well, about the question of who started all of this, it's not about that, but this has been a lingering issue, and we could not just leave it as is. And I think it just naturally popped up in our discussions. And I think each of our 3 entities have been tackling this separately, but we thought that we could come together as one and create much more power by doing this together. And that is why we decided to work together with three entities. So as for not for the timing itself, but I think it is something that was generated out of necessity to tackle this kind of issue together. Thank you very much. And now my next question is, it was also mentioned in the press release, as the national government, they're looking at this national healthcare system and also the electronic medical data platform, which will become the core of that. And so when you look at the collaboration with this system in the future, how do you think about, what do you think about how you will be collaborating this, whether you will be looking at aiming at making this into a really truly national platform or not? Well, so the national government is taking the leadership in developing this national-based data infrastructure, and we have been participating in such initiative, and we have been participating in their discussions. And so the policy of the national government and the initiative thereof is something that we really have been a part of, and we welcome that kind of approach. And with that in hand, as private entities, we would like to do something that we have not been able to do together alone, but now by coming together with two or three entities, I think we will be able to spread this kind of initiative and further develop the data platform even more by working together so that we might possibly be able to overcome social and medical issues. And so, of course, our initiatives and the initiatives undertaken by the government should not be separate and independent. I think we should be working together. So we still need to close the gaps between our initiatives and the national initiatives. And as private sector companies, there are something that we can do, and there is also something that the national government can do. And we would like to maintain good communication between the two parties so that we will be able to move towards a better future in a more efficient way. And if the national government invites us to participate, that is something that it will be more than welcome by us. Thank you very much. Any other questions?
Yes, also on the left-hand side, the third from this side, third row. Thank you. Utsugi from Newspeaks. I have two questions, if I may. First is about designing an app. Reducing the medical expenditures, I think prevention becomes very important. But it doesn't mean that everything has the same level of awareness that might prohibit the use of the app. So in order to promote people to use this application, how do you provide incentives and how do you design an app? Well, about in the area of the application development, I'd like to respond. Now, in penetrating this application to many people, I think there probably we need to have certain level of incentives. For example, when you download an app or when you use it for the first time, we want to provide the nudge or support so that people will continue to use it. So that kind of incentive, well, this time, we and LINE and PayPay, we would put all the efforts together to acquire users. So we have been working as a group, as a whole. So PayPay points, for example, we would effectively utilize that. Thank you. My second question is about the business model. I'd like to ask a question. So in the press conference, the medical institutions is having difficulty in having the sufficient budget. So in terms of the business model providing app, and how do you plan to reduce the cost on the part of the hospitals? Well, about the business model, among the three companies, we are still discussing, and there are many things that we need to discuss further. From our perspective, the EMR is something that we provide, and for long years we have been doing that. So we'd like to go beyond that. It's not just the EMR, but rather how the medical services can be improved. And also for the hospitals and medical institutions, their management, we would like to contribute to that as well. So wide-ranging values that we would like to provide. So we'd like to think about that thoroughly to develop the business model. So it's not just providing a software and we pay, we get the fee for that. It's not a simple business model. This is a healthcare business, and healthcare challenge requires more complicated approach. So we feel that based on our experiences. Thank you very much.
Do we have any other questions from the floor? So on the right-hand side, the fourth person, the fourth row from the front, please. Yoshida from NHK, and this is a question asked to Takashima-san. And SoftBank is using a user application, and so you already have Olive Healthcare. And how do you want to differentiate or separate this from what you already have? Thank you very much. With the Olive Healthcare that we already have, this is something that we are providing to our SMBC customers, and this is something that we have been working together with SoftBank. And at this moment, as a function, I think it has quite limited functions. So it is about medical consultations or online medical consultations. So it is quite limited in terms of what we can do as a service. So by combining this with this user application that we are talking about today, and by gradually replacing it with this user application, or gradually merging with the user app, for us, we will be able to significantly boost and enhance the functionalities of what we already have as Olive Care, and we will be able to provide much better services to the Olive Care customers. So that is how we think to develop this. Thank you very much. Do we have any other questions? Second person from the row in the central part, please.
Matsumoto from Business Insider Japan. I'd like to ask two questions to Tokita-san of Fujitsu. First, the EMR for the medical institutions, you are very strong, and in using the medical data, I think that each hospital could have different systems or different data. So I think that has been one of the challenges. Now, but working with the SoftBank SMBC, your healthcare business, I think it was the system introduction and supporting the operation. Now it's going to expand into the platform business, utilizing the medical data in the same way and align with others. So what are the business opportunities for Fujitsu, which is the main player already here? Well, thank you. As you said, the EMR was the only area that we were doing our business and providing the EMR for doctors of the hospitals. I think that's what we have been focused upon. Now, the medical institutions' IT, ICT systems actually are for the convenience of the patients and what kind of values that they can provide. I think that has been the purpose of IT systems of the hospitals. So various medical institutions, especially when we talk with the doctors, as you pointed out, the medical data are disparate and they are divided, and we want to, maybe we thought that this Fujitsu system have caused a part of that division. So now Fujitsu going into this area, this is something that we have been thinking for some time, and this is something that is necessary. So this is not only for the development of the medical services, but for the health of patients and also for the prevention of the diseases. If we can provide the various values, it would be very good. So data distribution, I think we have to overcome various challenges. So data itself, well, the individual patient's data. So we have to have a consent of the patient. So medical institutions and also the patient's consent. How do we get them? So we have to go overcome various challenges and to provide a platform after doing so. So rather than talking about the Fujitsu's business, I think that for the sustainability of our business in this area, I think that is very important. So this is a major opportunity that we can make a progress in with this partnership with two other companies. Thank you very much. My second question is about this Japan made in Japan developed. I'd like to ask a question on that expression. Your Takane was developed together with the Kohia. So this time you're saying Japan made. So is that about the models or has to do with the data storage? Which layer are you talking about? And being Japan or made or Japan developed for the patients and the medical institutions, what are the advantages? Well, as you said, what we provide, LLM Takane, is something that we developed together with Canada's Kohia. Takane is something that Fujitsu developed in Japan, and also the operation and others are done by Fujitsu in Japan. So that's the LLM Takane. So with that, this is Japanese AI and Japan-made technology. So about the services using this LLM, now the data sovereignty, how is it protected by the Japanese company? I think that is the key, and that based on that understanding for the users, I think that will give credibility for them. And based on the credibility, they can feel safe to use this. So that's what we aim for. So Japan made and also the sovereignty and whose data is it? That data sovereignty, I think, is the most important thing in the area of the healthcare. Thank you.
Thank you very much. Do we have any other questions? So on the left-hand side, from the fifth row from the front, the person in black, please. Yes, the female person in black, please. Thank you very much. Nakanishi from Nikkei Business. So about the partner companies going forward. So in your presentations, you said that you are also presuming participation from other partners. And I think that was mentioned briefly in one of your slides. So going forward, what kind of partners do you have in mind that you want to work together with? What kind of industries, what kind of companies, or if any? And also, if there are any companies that are already have been decided to participate, or if there are any candidates, please do share that information with us. I think it was in one of my slides. So it's not about identifying which company it is, but when we look at medical cares, we do need to suppress the expenditure, and that is a very challenging thing to do. And so it's not only something that just the three of us can solve altogether. So we're not really thinking about that kind of extremes, but I think we do need to have this collaboration between the public and private sectors together. So we would just like to get it started anyway. And so it's not about generating profits per each company, but I think for the time being, we will need to be investing more than the yield that we will be getting. But still, we understand that. And there are still many, many parts that we are lacking. And so in the major hospitals, we have what we call the EMR vendors. I think Fujitsu is number one in that area. NEC, IBM, are other people that we do need to call on, and we do need to collaborate with these kind of business providers. And also we need to reach into the smaller scale clinics in the rural areas. And we do need to also reach out to all kinds of vendors that are involved in this area. And it's not only in the medical area, but also in the healthcare system as well. So we do happen to have a business called Helpo. But from that perspective, there are other competitors in this area. We have several players in this area. And we do need to really overcome the barriers and work together. And we do need to really put our hands together so that we can join together in contributing to the future of this country's healthcare system. So we do need to move forward with the discussions. And if we are able to identify any definite partners, then we will be making the announcements as they come. Thank you very much. And so just to add, in system-related matters, this is an question to Mr. Tokita. So are you thinking of any other vendors? And so with the medical institutions that are already using the EMRs from the other companies, how do you think of utilizing the data that come from that kind of area? And how are you going to be communicating with the medical institutions to make that happen? Well, as I mentioned earlier, when it comes to the EMRs, I think collaboration and interusability of the data is very important. And that will become a major issue that we need to overcome when we look at what really can actually be done at the medical institutions. So the system solution for the EMRs, we do need to work together as business providers in this area, and we do need to have a common goal and get started with a joint initiative. So of course, with our own initiative, we want other people to and other players to also understand our initiative so that we can better utilize the data going forward and generate more value. And we also need to maintain good communication with the other players in this area so that we can hopefully work together with more players and utilize this data infrastructure together and build upon it. And of course, there are other EMR systems and healthcare solutions, and there are other players who provide this. And I mean, competition does exist in this area, but that kind of solution and this kind of initiative is something where people need to really understand. And it is actually the patients and the medical institutions that choose what kind of services they will be using. And it is not something that the service providers will be forcing this upon the medical institutions and the patients. So we do need to maintain good communication going forward. And this issue, so it's not only an issue of having the right kind of collaboration on the service provider side, but I think it is something that needs to be undertaken by the corporations as a whole. And whether a corporation is engaged or involved in healthcare, I think they need to move forward with a management culture of understanding the needs of providing good healthcare. And I know that many companies and businesses are really looking into this healthy management culture, but I think we should be able to provide some kind of inspiration to that kind of corporations as well. Thank you very much. Do we have any other questions? Okay.
The person in the third row in blue. Kaneko from Nikkei BP. I'd like to know about the time frame or timetable. As you plan to expand in phases, I imagine, but you also said that it is urgent to do so. So medical institutions and patients, how can you provide quickly provide values to them? So how to shorten the time for the development. So when, how, Do you think that you can make something visible? Could you talk about that? Yes, I'd like to respond. Specifically, of course, the specifics need to be finalized from now on, but for the time being, the parts that are already agreed is, for example, through the partnership, the business activities, we plan to start in October timeframe right now. So each company has various assets, so we will utilize them. So we will start from where we can start. So we will be doing this. So October is a kind of a target to start the business, and then the details will be shared as soon as we finalize them. Thank you. So you said October. Are you starting a company, or is it going to be the cooperative business? Well, basically, it's the start of the business activities. So creating a structure organization, and we'll start this business under the new structure in October. Thank you.
Thank you very much. Now we can just take two more questions. So in the central part at the very front. My name is Koyama, a freelancer. So I'm not really sure to whom I should address this. But so you talked about this objective of medical institutions, and if we look at 4,000 medical institutions, I think it is rather a small number looking at the total number of medical institutions. So for example, for medical institutions that have EMRs of Fujitsu, are you targeting them first? Or are you also working together with the pharmacies and to build up that 4,000 figure? How do you want to add out that number? Well, the number 4,000 as a goal was mentioned in my presentation, and it is not an easy present number. So in Miyakawa-san's slide, we also saw this, but there are a number of medical institutions using our EMR, and so we do need to add to that number. So as you know, there are more than 8,000 medical institutions in Japan, and so 4,000 means more than half of that, and that is a goal that we have set. So we have just roughly set that target. So we do need to communicate much more with each medical institution, and it's not something that we can achieve overnight, but I think we do need to have a behavior where we will be working more diligently with each and every individual institution and build up on that kind of relationship. And so we do have the numerical target, but that is something that just indicates our will and commitment to achieving that kind of goal. And of course, this business has to be sustainable. Otherwise, it will be just creating additional issues. So when we think about this having to be sustainable, I think the 4,000 is a good level to set as an initial target. So that means the target will be the medical institutions. Is that a correct understanding? Yes. So hospitals, of course, we also include clinics and smaller scale clinics. But in order to reach out to them, we do need to look into the IT infrastructure held by each of these institutions and the facilities. And also there are the issues of cost that need to be overcome. So it is not something that can be really done and rolled out in a larger scale just from our unilateral compassion and commitment. So we did mention the number 4,000. And so that really, first we are targeting the hospitals to get it started. And the second question is, in one of your earlier questions, we talked about the collaboration with the national government. And to what extent do you have that in mind? I mean, to what extent will it be possible? How do you think about that? I mean, when you are collaborating with the national government and sharing the information with the national government, of course, you can provide the data from your side and also integrate the information that can be provided by the government. What is the blueprint that you have in mind in that regard? Well, it is about data sovereignty, and we need to first technically and legally be able to make sure that we stand on firm grounds. And so there are many, many layers and levels that need to be defined. And of course, when it comes to the national government, I mean, it is just becoming one of the systems held by the national government. It will be an honor if we will be able to make that happen. But that is not something that I can just guarantee or make a commitment in front of you today. I mean, there are many, many systems and many, many platforms, and it serves no good to anybody if there are a number of different platforms existing at the same time. So when it comes to the usability and the convenience of the individual users, we do need to streamline that effort. And I think it is really important to make the system available to more people in a simpler way. So both the quantity and quality of the services need to be refined. And we need to discuss with the national government at which layer and at what level, to what extent and scale we can collaborate. We do need to determine that by discussions. Thank you.
So last question is on the left-hand side, the fourth row. I'm freelance. My name is Chiba. I am the representative of a Japan Real Estate Journalist Conference. What I'd like to know is that the major touch point of the healthcare is actually the housing. So that foundation, for example, embedded to the smart home. The other day, SoftBank, when you announced the earnings, one of the areas that you focused upon is smart home, you said. So is that something that you plan to do? That's my first question. And 2 days later, there's a cross-consortium announcement ceremony. So this is about the data integration. So Fujitsu and SoftBank are also part of that. So is that something that you go through to promote this? I just want to clarify that. Okay, thank you very much. Healthcare devices, when we talk about devices, smartwatch, for example, is something that we easily imagine. But as you said correctly, when you have a daily lives, I think that usually the center is your home. So various consumer electronics at home will become more highly functional. So part of that is something that can capture the vital data. We imagine that there will be various devices. So the health data of users, I think that there will be a diversification of such data. So working together with smart home is also something that would happen. So I think you're right. And what is important is that, as Tokita-san mentioned many times, who owns the data. In the world of the EMR, I think that the data belongs to individuals. So if you go to hospital A and B, the data of hospital A, B need to be integrated with the consent of the patients. So when you download an app, we would explain the necessity of that and say that we would like to create an environment where this type of platform will be implemented in the society. So that's our job. So working with the medical institutions, we would like to create such world. Thank you. Hope that answers your question. Thank you very much. So with that, we'd like to end Q&A session. So with that, we'd like to end the joint press conference on the partnership in the healthcare and medical fields to realize sustainable healthcare. Thank you very much for joining us. And also to the remote participant, thank you very much indeed.